So, this is what we're going to cover today, and it is a brief coverage of everything because there's a lot to get through. So, as a start, we need to understand that when we talk about sensory on the autism spectrum, we're not just talking about the 5 senses of smell, taste, hearing, touch and sight. We're also talking about proprioception, which is your body in space. So that's where if you bump into things, what we used to call clumsy children, they have poor proprioception. Vestibular, that's your sense of balance, and quite often those are the children that will do what I'm doing, pace backwards and forwards or rock. And then the 8th sense, interoception, which is your sense of internal body awareness. So it's really important that you understand that you've got to understand yourselves. If you get your inside right, the outside is going to fall into place. Now this is particularly important for people who have poorly developed interoception, which is many kids and adults on the spectrum. So interoceptive awareness is broadly defined as the conscious perception of internal bodily cues. So that's your biological signals and things like your heartbeat or your breathing. And all of these biological signals are related to our emotional experiences. So your emotions are just a collection of biological experiences. And it's not just people on the autism spectrum that struggle with interoception. It's also children who've experienced trauma, neglect, any kind of really difficult childhood, and also children with disabilities of any kind seem to develop it much later. There's a big implication for you in sights for this, and that is that if you have a poor awareness or lack of awareness or understanding of your internal physical body cues, then you can't regulate your body. So if you don't know that you've got those collection of signals that are telling you you're getting angry, you can't do anything about getting angry, and so the chemical cascade, which is anger, just goes on and you can't interrupt it. And this means that we see more overloads, shutdowns, meltdowns and challenging behaviour than we would if the students did have interoception.
Stress may seem like a byproduct of modern life, but the feelings which cause it are as old as humanity itself. An important part of our evolutionary heritage is the physiological capacity to respond instantly to a threat, or anything we perceive as a threat. We've come a long way, but the fight or flight response is still there. Today, we call it stress. This innate reaction automatically prepares us for direct and decisive action. Unfortunately, our body responds the same way even when direct physical reaction is no longer appropriate.
Basically, we are biological machines, and we are designed to fight, flight or freeze. And our internal body signals are what tell our body to do that. Now, as we've evolved and we've got better at reading our body signals, but if you don't realise that you've got that anger cascade going on, you just go into fight, flight, freeze mode. So the result is things like the students will hit somebody, and when you say to them, why did you hit them, they go, I don't know. And they really don't know. It was just a biological reaction. And this is something that's quite profound. So this is really important because when we talk about self-regulation, you have to have that awareness of the internal body state, which leads to the awareness of your own feelings and emotions. And only with those two can you then be aware that outside of you, things can affect the way that you feel. So if you don't have any one of those 3 edges of the triangle, you cannot have the centre of self-regulation. So when we have kids that are being problematic, it's not because they're deliberately being problematic. And if a child can't read, we teach them to read. But if they can't behave because they don't have interoception, we actually need to teach them interoception. Punishing them or having consequences is completely useless because it is not going to teach them how to read their biological body signals. So this is a really big change, and I understand that, but there is a lot more information on the intranet. Under Interoception 101 is the package with all the research and activities. So you, as a person in a site, can trial teaching interoception. Where they did this in the USA, they found it was effective and efficient. It helped the students and adults that it was tried with to develop self-regulation, self-awareness and social understanding. We started to trial this in term 1, and our trials are demonstrating that students really are learning to connect to themselves, and the interoception activities in themselves are able to interrupt that chemical cascade of the stress-distress pathway, and therefore can prevent meltdowns. And this is because we have 2 nervous systems in our body. You have your sympathetic nervous system. Now, sympathetic nervous system is not the good one. It's S for stress, and it took me a long time to get hold of that because it doesn't seem right. But I like this because it actually says S for stress on it, even though it's tiny writing and you probably can't read it. That is your fight, flight, or freeze mode. So that is the survival mechanism for the human race. The other nervous system is the parasympathetic nervous system. And you can't have both of them active at once. The parasympathetic is hopefully where you're at now. You're hopefully all feeling fairly rested and relaxed. The 2 little boys in bad underpants are showing us what happens to your body. So these are the biological signals that you get when your parasympathetic nervous system is active or your sympathetic nervous system is active. So if you think about students when they have heart palpitations or when they start hyperventilating, these are things showing you that their sympathetic nervous system is in action, and that chemical cascade into fight, flight or freeze is underway. Now, if they don't see that but you do, it is your job to help co-regulate them. And it's no good saying, oh, you seem to be at a number 4 on the 5-point scale, because if they don't understand their body, they'll just go, yes, okay. But they don't know, so you have to label it very clearly for them. I'm not sure how many of us go around holding a mirror to check if our pupils are dilated or not, but it's a good signal for other people. Because they can't both work at the same time, if you do something that distracts the chemical cascade, that interrupts it, such as focusing your mind on a deliberate action, like moving a particular muscle, or focusing on the breath going through your nostrils in and out, that focus on the bodily action interrupts the chemical cascade and starts the parasympathetic nervous system going. So this acts as self-regulation. What you can do is you can download the Interoception 101 from the intranet, so you can read about the theory, you can read about how it links to knowledge and social emotional skills. You can use it for your whole class or your whole site. You can also combine it with a flexible withdrawal interoception/learning space, which is accessible for the whole school. Because we know it is not just children on the spectrum that this impacts. Alexithymia is something that is very closely related to interoception, and the researchers actually can't agree if it occurs because of a lack of interoception or it causes a lack of interoception. I think they're probably just an aspect of each other. I think they're the same thing, really. And about 50% of people meet the clinical criteria for alexithymia, which is an inability to recognise and describe your own emotions. So I want you to think about right now how you're feeling, and I want you to tell the person next to you how you're feeling and how you know that's how you're feeling. How are you feeling?
Relaxed, and
How do you know?
because of the way that I was sitting and breathing.
Okay, thank you. Did anybody struggle to explain how they knew how they were feeling? Yeah. It's not actually that easy for everybody. If you didn't have a problem with it, it can be really hard to understand how some people can't do it. But this is a very real clinical thing that psychologists bothered to sit around with and psychiatrists and diagnose, that you cannot recognise and describe your own emotions. So for these children and adults, when you ask how they're feeling, they may well just say something, but that is not necessarily a true reflection of how they're feeling. because they've learned you're supposed to answer this question. If you say, I don't know, people don't like it. So you just randomly make something up. Now, Spock is the most famous alexithymic in the universe, and he's real, so you can see that it's real. This is such a big part of life for so many people on the spectrum that it actually got research funded in the US. Millions and millions of dollars, and what they came out with was Oxytocin. If we sprayed it up the noses of alexithymics who were on the autism spectrum, would it fix them? And the answer was no. So don't go rushing out and buying it. Interestingly, it did help some people. So oxytocin is your happy chemical. The interesting thing is, if it helps some people to, in particular, respond to their positive emotions and express their positive emotions, maybe that is a chemical imbalance for those people. But for all the people it didn't help, perhaps that is a brain hardwiring. Perhaps that is something like not having interoception yet. We also can use social skills to help us respond to the emotions of others. So McLaren did some research around social skills, and it was very interesting because what she found was that she did 91 social programs and they were all ineffective. I think that's pretty stunning. They were all ineffective. And I think this is part of the reason why. So we've got some pictures of people socialising behind us. Which picture do you think illustrates autistic socialising? They are socialising. They're sitting, they're interacting on their Etch-a-Sketches by parallel play. So my son's sitting at home parallel playing on his computer online, as do millions and millions and millions of people around the world, typical and autistic. And yet our social skills programs are designed to teach kids to do this. Now, who actually wants their kids doing this? So why is that the goal of our social skills programs? I don't understand it. And the interesting thing is that what it is about normal socialising. Social skills programs teach normal socialising without accepting that that's what they're doing and without being obvious about it. So McLaren said the reason that these social skills programs all failed was that because the people teaching it are performing their normality unconsciously and accepting it uncritically as true reality for everyone. And that when autistic children behave in the ways that they behave by doing things like communicating with body movements or using vocalisations that are not typical, that this is seen as breaching the hidden rules of normal socialising. And it creates a negative reaction in most people and a reduction in empathy in people who don't understand that socialising is a social construction. And what is normal is different in different cultures. How many of you are from Italian descent or families? Okay, do your families talk with their hands?
Some, most of them.
Yeah. Now, how many of you are from British descent? How many of your families talk with their hands? A few. I would add that they must have other ethnicities in there then. Because in Britain, you don't talk with your hands, unless you happen to be autistic or deaf, in which case you probably do. And it's very interesting the amount of time and energy and effort that is spent on helping autistic children look normal. And the thing about being autistic is we are not autistic. We are autistic, and therefore what is normal for us is different than what is normal for people who are not autistic. Should add, I'm on the spectrum. So, what is autistic socialising? It's really interesting because when Ox and Solomon did their research, what they said is actually in trying to enforce normality, so saying don't flap your hands or don't use those vocalisations or don't use echolalia. It actually interferes with autistic children's development, acquisition of language, social skills, and their sense of belonging in this world. That's phenomenal. That means we've been doing stuff that is damaging and we didn't know because other experts said it was a great idea. So this is lots of big changes in research in the last 10 years. Eye contact and even face-to-face alignment can prevent some autistics from being able to focus or communicate. So when you request eye contact in the classroom, I'll never forget the little boy who said to me, it's like having daggers stuck in my eyes when I have to look at someone. I don't have a problem with eye contact, but for autistics that do, it is a big problem and they cannot listen and look. So which would you rather they did? And if your body movement is an intrinsic part of autistic socializing, it is the equivalent of telling a deaf person they cannot sign to say stop moving. And we wouldn't do that, hopefully. For me, this picture is a pure expression of joy. If you see me skipping in the supermarket, it's because I'm super happy. Doesn't often happen in a supermarket, but... We think now about social skills. Hopefully you'll start to think about, well, what is it that autistic young people need to grow up to be happy, healthy autistic adults? What is going to meet their needs for socialising? Now, for me, the most important aspect of socialising is being comfortable in your own body around other people. And we don't often meet that. That's not what we're focused on. So if you do want to do an effective social skills program in your classroom or your site, it has to be individualised. That doesn't mean necessarily just for that one person. It could be for that group or for that class. Those of you who work in sites where all the students come to school, or 99% of them, not knowing the basics of things like please and thank you, that might be a focus for your social skills group. We're seeing more and more typical kids arriving in schools not actually being able to get on with other people, do things like turn taking. So you could be having a whole class social skills program. It doesn't just need to be for those kids on the spectrum. It needs to focus on specific needs, concerns and interests. Are any of you from secondary schools, high schools? Yep. Your kids want to know how to date or how to phone up people to ask them to go to the movies. But we never talk about dating in social skills programs. But that might be appropriate because it's age appropriate. And it might also be ability appropriate. We also need to think about, okay, how are you going to be happy as an autistic person? How can you navigate the culture of the world around you, which is referred to as neurotypical culture, which means having brains that are in theory typical, rather than being asked to be changed by it. And it's interesting because I was just in New Zealand, I was at an inclusive education conference, and one of our keynotes was from a very prominent Maori academic. And she was talking about the research in New Zealand saying that one of the reasons that Maori students are failing at school is because they're being asked to leave their culture at the door. And we need to make sure that they can engage in education as Maori and succeed as Maori. And I'm asking that you enable autistic students to engage as autistic students and to succeed as autistics and not try and transform them into something they're not, because it's damaging. We also tend to put our social skills groups in like a really small room that kids never use any other time. That's not helpful because the sensory aspects of being somewhere you don't know and the emotional aspects are not good. And they need to be based in real life. I would wager that a student who can't ask for something, who loves chips, is going to be able to ask for chips at their favourite shop. That you can then model into more and more social skills. Using real life is much easier than using cartoons and icons and things. Video modelling seems to work for a subsection of the autistic population, but not all. And these are just pictures of autistic people socialising and doing things that make them happy. So I would really like that sites incorporate the evidence-based effective strategies that you used, the points in the previous slide. For me, one of the biggest learning curves was around communication, because as you can tell, I talk. I have talked non-stop since I was little. And I wanted to know a lot more from autistic adults about how they did or didn't speak and why they did or didn't speak. And it's interesting because it is these adults that have changed the way that we understand autistic communication. It's not researchers sitting in a university or a lab. These are the reasons why some autistics never speak, or why some speak much later than other typical children. And I think that Peanut's "My Anxieties Have Anxieties" is really relevant to this slide. Not having a reason to communicate. How many of you have family, friends, or relatives who've got little kids and they pick them up without the little kid having to do this? This is reaching your hands up towards the person. Now this, at its basic, is communication. If something is always done for you, you do not have a reason to communicate. We need to enable little people to have a reason to communicate. Being overwhelmed by sensory stuff or emotional stuff is the number one reason for not being able to speak. Having auditory processing difficulties. If the words take such a long time to be processed in your head that by the time you've formulated an answer, your family have moved on or the teacher has moved on, eventually you give up. That anxiety can mean that you just get paralysed with fear and can't open your mouth and the words just don't come out. Executive functioning, you think, well, what's that got to do with speech or communication? But actually, when we speak, we plan what we're going to say, and then we say it. It's just almost automatic if you've got really good executive functioning. If you don't, it's really hard to sort of do that planning, because by the time you've planned, everybody else has moved on. Not knowing what to say or how to say it. That can be very context specific. Interestingly enough, many of these adults who are still non-speaking taught themselves to type. And there are some really good books written by non-speaking adults and some amazing poetry. Search this out on the web to prove to yourself that not being able to speak has got nothing to do with intelligence. But we need to give our children of all kinds communication systems, and if you haven't got the speech communication system, you need one that is two-way. It's no good just having Prolo to go on your iPad and absolutely nobody else in school but the SSO can use it. What happens when the SSO is sick? What happens when you go to the shop with your Prolo to go and nobody can use it? It's not a communication system unless it's two-way. We prioritise writing by hand in schools still, and I fail to understand this because you don't even fill in job applications by hand anymore. It used to be, I could say to students who struggle to write, but you need to write to fill in forms. We don't anymore. They're all online. If you have poor interoception, actually this affects your ability to write. There's explanation in the document. But motor coordination, sensory stress, extreme anxiety, executive functioning difficulties, low muscle tone. Think about how hard it is to hold a pencil if you've got low muscle tone in your hand. All these can affect the ability to write. Typing is a very different cognitive process to writing. There is absolutely no reason to not let kids type. It is a reasonable adjustment under the law. Unless you are marking handwriting, there is no reason. What it does do in insisting on kids writing and speaking is mean that we have historically had really inaccurate assessments of autistic students' abilities. And then you get this cycle of low expectations because they test worse, therefore we have lower expectations, therefore we give them less challenging work, therefore they achieve less. It actually increases the anxiety hugely if you don't find speech or writing natural and that's how you have to work. If I said to you, okay, you can only write notes in Russian, how many of you would feel comfortable writing notes? Effectively, that's what we're asking children to do if they are not natural writers or speakers. And we know that long-term stress leads to mental health difficulties and physical health difficulties. And I don't know if you understand the negative thought loop thinking of autistic students and adults. So we have these fantastic broken record brains, and if you don't know what a record is, it's an old piece of vinyl that goes round. When the record is broken and it does that, this is where autistic people's brains get stuck on negative input. And this means that your anxiety will increase over time. Your sleep gets worse as you're trying to process it. And it does lead to work and school refusal. We have far too many kids who are not in school because of these issues. So, your next steps are really simple. You're going to make sure all your autistic students have got communication systems. I really would ask, please make sure that they can explain their preference, whether they want to type or write or record orally into a phone or a dictaphone, because we're trying to assess kids' learning. We're not trying to assess how well they can write or speak. And where that is the case, it should be used for all written work. You can't say, oh, well, in geography you have to write by hand, because everybody else is writing by hand in geography. It's not how it works. If you are teaching handwriting, use topics of interest. I worked in a very rural school where they had a student who refused to do the handwriting. So he was fascinated by dinosaurs. I asked him to write dinosaur flashcards for me, and he wrote them. But no way was he going to sit there and write A over and over again. So use passions and interests. If it's a real-life application, it's more meaningful. You can see a reason for it. Echolalia is a very useful tool. Echolalia is the repetition of chunks of speech, and it can be immediate, such as if I say, how are you? The person says, how are you? That's immediate echolalia. If they're repeating a phrase from Thomas the Tank Engine 4 hours later, that's delayed echolalia. But it's a useful mechanism for learning where does this chunk of speech go. So respect the use of echolalia and model appropriate speech if they are speaking. Improvisation is very uncomfortable for many autistics, but it's also very useful, and drama is a very useful tool. One of the most insidious pieces of research that was done years and years ago was said that all autistics need routines. And the problem with this research was that it was flawed because it didn't actually understand autism or autistic people. And we have got a generation of young adults who are routine dependent, who are unable to work, who are unable to function because the world is not routine. When I lived in Christchurch, these adults were the most affected during the earthquakes because there was nothing left routine. And they had no resilience because they had been brought up with very, very strict routines. We need to help autistics learn that change happens, that it's okay, the world does not end. When the Pinery Ridge bushfires were on, there were changes. If you were routine dependent, that would have been more devastating than the actual fire. This is not okay. We can't do this to our young people. So now that we know that this is not the case, we need to think, okay, well, what is it that they do need? And it turns out it's predictability. We need to know what's going to happen. It's not about having that routine. It is very much just about knowing what is coming next. Predictability allows people to say, is it worth it for me or is it not worth it for me, instead of just being racked by anxiety. So I'm going to tell you about spoon theory at this point. I've got really into spoon theory. Who knows about spoon theory? Okay. In the morning when you get up, you're given, say, 20 spoons. Everybody is given 20 spoons. Now, every time you do anything that takes emotion or physical energy of a significant level, you have to drop a spoon. Now, your 20 spoons are all you have to get through the entire day. Now, for a typical person, getting out of bed is not a problem. If you have a health condition or a physical disability, getting out of bed will take a lot more effort, so that would lose you a spoon. Eating breakfast might lose you a spoon if you're autistic because mum ran out of toast and there's only Wheat Bix and I don't like Wheat Bix, so you lose a spoon. Now, if you think about the way that autistic children like to have that predictability, if there is no predictability in their household, they will lose a lot of spoons before they even get to school. And then when they arrive at school and there's a TRT, they're going to lose some more spoons. And then the students in class behave differently when there's a TRT, so they're going to lose some more spoons. By morning tea, they might have 1 spoon left. So they get back in from recess and you say, okay, we're going to do handwriting now. Do you use your 1 spoon on handwriting, or do you save it for later in the day when you've got to get from school home or you've got to survive lunch? So spoon theory is very big in the disability world, and it is a very easy concept to understand. And if you look at your students and thinking, instead of, oh, it's a bad day, I wonder how many spoons they've got left. You can think, how do I help them keep their spoons? I help them keep their spoons by having predictability. I help them keep their spoons by saying, if this is too much right now, we can do it later. And we want the students and young people to not have meltdowns at school. We need them to keep all their spoons until they get home. But this is the reason, one of the main reasons why so many kids who do manage all day go home and have meltdowns, they ran out of spoons on the way home. And so when those families come and they say to you, my child's having meltdowns every day at home, and normally your response is, oh, but they're fine here, maybe it should be, okay, let's see where the stressors are. How can we get them to keep another couple of spoons? If you use scheduling of any kind, it really helps with that predictability. And because you can have a change symbol that you put over something that's changed. And if the child can read, you can have a little phrase that goes with it, something like, things change, it's okay. Because it is okay. The world really doesn't end. But you don't know that unless you're told that. I'd really like you not to have routines and not panic when your routines are having changes. Having a timetable is not the same as having a routine. Having a timetable is predictability. Routine is at 9:05 we do this, at 9:10 we do that. It's much more structured. Highly structured teaching can work for autistics who are very, very anxious, who need much stronger predictability. And Swati at Modbury Special School can come out and talk to you about that, or Siru have information on that as well. But also, there's a really nice YouTube clip of a high school, and it's a teacher who gets, it must be a special school because he's only got about 8 kids, and every morning they come and they sit in a circle, and he tells them all the changes for that day. Knows it's okay that things change because I'm going to be told that things change. There is a much, much higher incidence of mental illness among people on the autism spectrum of all ages. Unless you are a psychologist or a psychiatrist, Your job is not medication and talk therapy. So we can have kids using medications in our schools, that's not an issue. It's that you can't be prescribing them or recommending them. And talk therapy requires specialist knowledge. And the reason that medication and talk therapy requires specialist knowledge is that autistic reactions to both these can be different from typical people. So, for example, people with intellectual disability need different dosages of drugs than typical people. So do people on the autism spectrum. They might need absolutely truckloads of one drug and tiny, tiny doses of another. So the therapeutic drug range for these people is not known because it's individual. Why do so many kids and adults have mental health difficulties? So we know that these are the contributing factors. Bullying. We know that most of our autistic kids are bullied in schools. Lack of sense of belonging. If your social skills program is trying to teach you not to be who you are, would you develop a sense of belonging? No. Feeling of alienation. Believe me, before I had my diagnosis, I still knew I was different. I still knew people thought I was different. Fixated thinking, that broken record thinking contributes. Perfectionism. Perfectionism leads to anxiety. Lack of sleep. Many autistics have chronic insomnia. I get really excited when I have over 5 hours sleep. I'm up to 3 nights this year that I've had more than 5 hours sleep. Yeah. It's exhausting. So if you can imagine you've only got your 20 spoons and you have 3 hours sleep, you're going to lose some spoons before you even get up. Sensory overload, all these things contribute. And when you think of mental health, it's actually a continuum. So you start on the well-being, which doesn't mean you have no distress or stress. It just means you have it occasionally. And there's no impairment on your life because of that. When you have mild or moderate distress, you can be temporarily impaired or mildly impaired. But when it gets to mental illness, the distress that you're experiencing is quite significant. And it can lead to chronic or disabling impairment. So when your anxiety is so bad that you can't get out of bed, or your depression is so bad that your body slows down so much that you actually, even your digestive system slows down. And we know that. So anxiety and depression are really significant. When Neil Humphreys came over last year, and he was talking about the vulnerabilities of children and students on the autism spectrum, he was saying that bullying is the single most contributing factor, and that sites don't recognise the bullying because it's done in a specific way. And because autistic students can't always articulate exactly what happened when it happened, they're often not believed. And the other kids know this and they take advantage of it. And they're very clever. They know exactly what button to push so that John will go and hit other people and John gets into trouble, but in actual fact John is being bullied. Any negative stress increases the likelihood of short and long-term issues. Eating disorders are far more prevalent among autistics than their typically developing peers. But so is gender and sexuality diversity. And we know that these students get bullied more in our schools. We know that the prevailing climate in the media doesn't make those people feel safe. How does that make those kids feel if they're part of that diversity? So all those things all contribute, and it leads into that awful cycle of you having the chemical cascade of stress so much more often that you become more heightened, that then even little things that shouldn't normally be distressing are distressing. So what you can do about this is you can be really proactive, and you can teach protective strategies such as interoceptive awareness, mindfulness techniques. So if you're living in the moment, you're not having broken record thinking. It's about trying to stop the broken record thinking. Whole school policies need to be around for bullying and ensuring inclusivity. And when we think about inclusion, it's about everybody bringing who they are to the site and being who they are, not everybody being told, okay, you've got to be a particular way. One of the other people that was going to present didn't actually want to come, so I've got some words from a young person who's 17, and I'm going to share these with you. And then when we're thinking about mental health and when we're thinking about achievement and success, teachers are such powerful people, and so are SSOs. And what you say as educators can make such a difference, whether that's in a good way or a bad way. And in a good way, you can help people achieve things that they would not have dreamed they could achieve without somebody believing in them. This story was sent to me, and I was asked if I would be willing to share it. And I have changed the person's name. And it's quite sad. I've taken out big chunks of it because it is really quite sad. But all the bits that are here are in her words. My name is Amy and I have autism. When people see me, I'm positive that autism is not the first thing that comes to mind because I'm not your stereotypical Aspie teen. I have extreme interests in makeup and dogs, and I love socializing. I'm currently 17, surrounded by family and friends I love and adore, and I'm very happy with what I'm doing in life. But it wasn't always like that. Growing up, my parents worked hard on my confidence because when I was younger, apparently I didn't talk very much when I wasn't at home. Having this confidence helped me more than I realised at primary school. I tried to fit in, but I know I wasn't very liked by the others in my class. In high school, I do remember the girly drama that I never really wanted a part of, but always got dragged into, and that was horrific. Girls would physically fight each other, and the school never did a thing about any type of bullying. I tried to negotiate if I could not do design and tech because I hated the smells, loud machines, and all the wood dust. But all the other kids had to, so I had to do it too. So on those days, I either wouldn't go or I'd sit in the toilets crying. After 14 years of pretending to be normal and trying my best to fit into society's boxes, I crumbled. I became depressed. My anxiety went through the roof and I got diagnosed with autism. I left school and ended up in hospital, Boylan Ward, a few times due to suicidal thoughts and actions. And this was actually aged 14, 15. When I did go back to school, it was worse. The teachers thought I was making it up or doing it for attention. The teachers wouldn't let me do what was in my NEP that would help me calm down because the other kids aren't allowed to, so why should she? I started to miss lots of school because of my anxiety, and then I got bullied. She's actually homeschooled now, and I was sent the final report for this child. And I cried because teachers in my system that I work in refused to say anything positive. It said things like, if this student had actually been at school, they might have done their work. She was in Boylan Ward. How can we do that as a system? And this is not saying that any of you do this. This is saying this is real. And it's not okay. Our young people are so vulnerable. They're more at risk for so many things. And if saying, it's so great to see you again, Amy, I'm glad we've got an NEP. Let's follow that. But they wouldn't even do what was in the NEP. And I know that lots of you have had problems around what is a reasonable adjustment and what isn't. And these things will be clarified, hopefully in the next month. The guidelines, new guidelines, and new autism support plan will be released. This is not meant to depress you. This is meant to really help you to understand why some families are so angry and upset and what happens to the young people when we don't do the right thing. Everyone is not a bit on the autism spectrum. You're either on it or you're not. Just like you're pregnant or you're not, nobody is ever a little bit pregnant. However, what you can have is some traits of autism. So the traits of the autism spectrum brain: thinking about detail, perceiving information independent of context, logic focused, enjoys known or preferred experiences, focus on self and preferred people or objects, places, concrete, logical thinker, literal interpretation and use of language. Somebody on the autism spectrum may not have every single one of those, but they have the majority of those. The non-autistic spectrum brain tends to be thinking about the big picture, tends to perceive information in context as well as the information, tends to be feeling or emotion focused. Now, if you think about that, the difference between being logic focused and emotion focused is huge. And emotion has a social construct context. So we need to be very aware that although some kids can have aspects of it, or you yourself might have some aspects, unless you're on the spectrum, you don't necessarily understand what it's like. And it's very, very different. And I think hopefully you get a little bit more of a sense of the complexity of autism and the difficulties associated with it. But there are huge strengths too. When you can get your kids to be focused and have hyper-focus when they're on the spectrum, they will achieve huge things. So it's just about getting them to that space. The genes that are implicated in autism are actually associated with intelligence. Not all the genes, there's hundreds of genes associated with autism. But I find it very interesting because we tend to think of intelligence as academic intelligence, but it's different according to different cultures. The difficulty in autism is the mismatch between the environment and our sensory issues and the way that we express our innate intelligence. You can maximise achievements and minimise mental health risks by teaching students through their interests. This is official policy in a number of countries. Adults will gain work and keep work if they can do it in their areas of special interests, much more likely. So you might know Pokemon. So the inventor of Pokemon is on the spectrum. He is a gazillionaire. He invented Pokemon because his interests were bugs and computers, and he was told in, an education system that is very strict, don't be ridiculous. Well, clearly he wasn't being ridiculous, and it's a picture from Temple Grandin. So if you can incorporate those interests and passions, we can drive a confidence cycle. So instead of driving that negative cycle, we can actually drive a confidence cycle, because the more success you achieve, the bigger your confidence, the greater your ambition, the higher your goals, the better your motivation. This is what makes athletes win. It's not that they are innately the best athlete on earth. It is that they have the confidence and the motivation and the ambition to keep practicing and keep achieving. We also need to explicitly teach our students what their strengths are and challenge them to maximise it. So much of our time in schools and preschools is on what kids can't do when they've got a diagnosis. Needs to be on what they can do. If somebody is a good writer, tell them they are a good writer. They don't necessarily know. If they're good at maths, tell them. If they're kind and compassionate, tell them. You can make a living out of being kind. That's what nurses do. That's what many, many professions are based on, is kindness and compassion. And I think when many of you started teaching, that's what you thought teaching was based on. So we can go back to those kind of relationships. From year 8, we need to be helping students transition to work or further study. And we need to be explicitly teaching them. Because I didn't know he had an interview, so I hadn't reminded him what to wear. And he looked quite sheepish and went, there's been lots of socio-political changes around autism too because of a lot of the research. If you haven't read Neuro Tribes and you've got some spare money or you belong to the library, go read Neuro Tribes. It is a very good summary of the changes in the way autism is viewed and the way that it should be viewed now. I hear a lot from people about the rising numbers of autistics. Yes, that's because we didn't diagnose it many years ago. It's a bit like saying, you know, there's an increase in the population on Earth. Yes, there wasn't people millions of years ago. And it's really interesting because if we had really paid attention to the original definition of Asperger's, we would never have been looking for environmental causes. We would have been celebrating the good stuff. Because people with Asperger's tend to be able to achieve in a narrow focus. Think of the Mad Professor. 99% of them had Asperger's. But instead, we focus on what they can't do and then they can't achieve because all they think is what they can't do. I'm not going to read this. If you're interested, Google Jim Sinclair. The speech is called...
Is it Don't Mourn for Us?
Yes, Don't Mourn for Us. Very interesting political... DECT policy has always been person first. I am autistic. I choose to describe myself as autistic, as do many, if not most, autistic adults. We are obviously people. If you can't tell that, you have a problem, not us. We don't need to be person first. We are people, but autism is so much a part of who we are that that is how we choose to define ourselves. I don't go around saying, you know, I have red hair. Hopefully you can tell that. You know, if you're colourblind, that's fine. I don't mind if you think I have green hair. But if you are going to use a person-first type phrase, please don't say with autism, because to many of us on the spectrum, that implies that we're holding a suitcase with autism and you want us to leave the suitcase behind and be without autism, which implies that we are not okay as we are. So if you use person first, if you say on the autism spectrum or on the spectrum, that is more respectful than saying with. So we are going to have sensory overviews available for you very soon. And these can be used for kids that aren't on the spectrum too or don't have a diagnosis. And they will be really helpful for you. Completing an autism support plan, again, that will be available shortly. And these must be done with the family in order to meet DDA and DSE regulations. And do the autism online training if you haven't done it. They've updated it and it's really good. So, thank you very much for listening.